In this episode, I'm fed up with the idiotic science deniers who keep pushing mask and vaccination mandate bans. I hate wearing a mask too, but their failed logic, and that is being kind, will prolong the pandemic and harm people needlessly. Why do the people who do the right thing have to carry the petulant children who kick and stomp their feet? Enough is enough. This is Secular Left. I am very, very, very angry at the moment with some of the people in this country. And it's to the point where I start thinking bad about stuff like that. I want to throat punch people in the mouth and just throat punch them for some of the stuff that they're saying and doing. Things are coming to a head. School is about, well, in some places school's already started up. Here in Ohio, school's close to starting up. And we have a bunch of whiny ass parents who don't understand science, for one thing. They don't understand product liability in another instance. And they are going to these school boards and demanding that there be no mask mandates. Now, what does that mean? Well, we still have a pandemic going on. We have the Delta variant that is right now, as I record this, Ohio, well, at least where I'm at in Ohio, it's all red, like deep red, like serious community transmission of COVID-19 cases. And so many businesses, stores are reinstituting mask mandates. Some schools, such as Toledo Public Schools and some other schools around the area, have now decided to go back to masks for at least for kindergartners through, I believe it's third grade. However, age 12, because age 12 is when you can start getting the vaccine. They are encouraging people to get the vaccine. Other businesses have started to require their employees to be vaccinated, which is a good move. But you have this group, and I have to believe it's a small group, but man, they just take all the oxygen out of everything with their bellowing and blurting about mask mandates and not understanding science and not understanding logic and making these arguments that stuff that they learned off of YouTube as if that's evidence. And I'm pissed off. I'm pissed off that these people are getting airtime to air their ridiculousness, and that we have a political system, a political party that is pandering to this wackaloons, these wackaloons down in Columbus. It's infuriating. You know, it's the same political party that has never avoided a government regulation to take away a woman's right for reproductive choice. You know, this party has stuck in dozens and dozens of regulations into budgets to take away a woman's right to have an abortion in Ohio. And they stick it in the budget so that people can't have a petition to put it on a ballot to vote on it, because you can't challenge a budget here in Ohio for some odd reason. And these same people that don't mind government regulations of somebody's sex life, you try to get them to comply with public health orders, And it's like they start comparing themselves to Jews during the Holocaust. That's insulting. It's insulting to people. It's insulting to Jewish people, for one thing. And I'm tired of it. I'm just tired of it. Here in my area, Findlay City Schools, it's Trump City down there. Won by a wide margin. Red. No Democrat ever successfully gets an office in Findlay or Hancock County. So they had a school board meeting. To talk about a mask mandate. And they allowed input from people from the public. And so this one woman who is a former council person put these videos up, and I was just shocked. I was just shocked at the illogic and the idiocy, the undermining of medical people that these people attempt. You know, they get this arrogant idea that they're not doctors, and neither are the school board members, so that means that they know just as much as the school board member, which is not the case. These school board members aren't doing this to get back at people or to forward some kind of left-wing agenda to make you a communist. You know, these school board members, they get advice from the experts, the actual people who make money, who went to school to learn this information, virology, immunology, medical doctors. They consult these people, public health authorities. They look at the data. They see what's going on. They get advice from them before they make a decision. But these parents that go to these meetings believe that they know more than medical science, that they know more than the world, medical science in the world. You know, this is still a pandemic. Over 4 million people have died in the world. Over 600,000 in the U.S. alone. And so far, the medical science has been spot on. You know, somebody who watched a video to drink bleach to treat COVID-19, they didn't win. The medical science is winning. But then you have politicians that are so into controlling people and staying in power that they undermine medical science in order to score political points. It's shameful. It's shameful. And like I said, I'm just sick of it. I'm just tired of it now. But I wanted to play a couple of clips. This first clip, they're rather short. It's just the audio. It's from this video that this former politician in Findlay took. And the first one is a male parent. I'm assuming he's a doctor. I think he's a doctor. The audio is kind of iffy at the beginning. And he talks about masks. And you listen to him and you think he knows what he's talking about. I mean, obviously he's a doctor. He wears a mask. He knows how they work. All right. And so just listen to this clip and I'll comment on it when we come back.
The craziness is starting to begin, right? Buildings, MP had a great presentation. The big question is mask or no mask, right? Before we do that, I do have a silly question. So I will ask Matt Cooper, do you like your steak medium or medium rare? Is that silly? It is silly, right? Right. Okay. Got it. Everybody likes their steak medium or medium rare, right? Right? Do we like scrambled eggs or dippy eggs? A lot of people like them both, right? I like cookie dough from Jolly Dipper or Archie's. Those flurries are the best. I saw a shake of the head. Everybody likes cookie dough, right? Do we all know those are recommendations from the CDC that we're not supposed to do? 65% of the American population actually order their steak medium rare, and it's against the CDC recommendation. Isn't that crazy? So I'm saying let us parents dictate. I'm not saying for mask or against mask. Just let us parents choose. Don't mandate the masking. It's a health issue. To do what the CDC is saying to mask 2-year-olds. I mean, we have kindergartners that I've heard have come home and they have Cheetos stuck in their mask. How is that healthy? So all I'm saying is, if we want to look at health of kids, just let the parents decide. If we want proper masking, I work in the operating room for over 15 years. When you're in the operating room, you don't touch your mask. When you come out, you rip it off your head and rip the strings and throw it straight in the trash. The minute you touch your mask, you're not sterile anymore. You have to remove yourself from the operating room. That's how masks work. The average person touches their face 23 times an hour. That's the person. Now think that to a kid, and then we can probably double it again for kids that wear masks. So now they're touching their face, I'm assuming, and you shouldn't assume, right? 60 times they're touching their mask every hour. That's not, a mask is not working. I've watched all of you online in your meetings last year, and all of us, when we go to the grocery store, we touch our mask, we touch food, we touch the door handles, you touch your computer. That's how the virus spreads, right? Masks don't work in that way. And so that's why, if we have to do it, we have to have proper masking, right? So that's why I'm saying, just let us parents do that. Let us decide. You guys are great educators, and that's why we're in this community, and we have so many more. If you hear me, I will preach against all those other county schools that we have the best academic opportunities, and I truly believe that. Last thing, I'll leave with this. There was a study, and it was quoted in our own Courier from Johns Hopkins. Since to date, there's been 335 deaths of 0 to 18-year-olds. Kids have a better chance of dying at your lunchroom table choking than of this virus. Please let us choose to mask or not mask.
All right. Well, first of all, he tries to compare a CDC recommendation in mask wearing with a CDC recommendation that you shouldn't eat raw meat, as if those are exactly the same or should be treated the same. That if you make a personal choice to eat raw meat, that should be your choice. And I would agree with that. If you want to eat raw meat, if you want to eat tainted food, if you can find it, go to it. Have at it. It's great. Good for you. But mask mandates and public health orders are nothing like personal preference for the doneness of your meat, or eating the wrong foods and getting fat. That has nothing to do with public health orders. And most rational people know why it's different. It's different because if you make that choice about the red meat, or you decide that you're going to smoke unfiltered cigarettes, or whatever the health recommendations that come from the CDC, if you decide to do that and go against the CDC, that's on you. The effects stay with you. The heart disease stays with you. The cholesterol stays with you. The blood clots stay with you. You are only the one being affected by your choice. Now, if you decide to ignore a CDC recommendation about a public health order, such as not wearing a mask, not getting vaccinated, that is not only on you, but your choice can affect other people. They had the study out just recently. The CDC said that the viral load in the nasal passages of an infected person who is fully vaccinated, that means, and I hate to science explain this to people, but yes, fully vaccinated people can be infected by the COVID-19. Now, what that means is you have the virus in your nasal passages, and it does enter your body. You are infected by it, but the symptoms are less. You aren't, in most cases, you don't have to go to the hospital. You aren't put on a ventilator, and there's less of a chance of you dying. But let's say you're fully vaccinated and you refuse to wear a mask. You still get the viral load in your nasal passages. You are still spewing those viral loads out as you talk, as you sing, as you hug people. And then there's going to be people that are not vaccinated, maybe because their immune system is compromised or they're too young, and you're going to pass that virus on to them. They are going to get sick, possibly end up in the ICU, possibly dead. So your choice, that you are so adamant that it's your choice and your freedom, is not just your choice. That is why this father was wrong. That is why people who are against the mask mandates are wrong. That's why the politicians are wrong. Because the science data does not back up that if you choose not to wear a mask, it only affects you. No. You can possibly infect other people. And it's been that way since the first day that this pandemic started. The second thing that this person at the school board meeting was wrong about was when he was talking about that you touch your face 26 times and kids touch their face and so the mask isn't sterile and everything. Well, only people who are against mask mandates think that the argument is that you have to wear a mask because it 100% prevents you from getting infected. That is not the case. Nobody says that. Nobody that supports mask mandates say that.
And not to mention that the primary means of transmission for COVID-19 is through droplets expelled while you're breathing and through your nose, and not so much from the surface. So even just some minimal cleaning and hand washing is effective against the virus.
All a mask does, especially the paper mask that you see, the common paper mask that you see, or cloth mask, is it creates a barrier between you and the person you're in, if you're in a group of people. So it significantly reduces the amount of droplets. That's how the disease is transmitted. That's how the virus is transmitted, is by droplets. It significantly reduces the amount of droplets that you are exposed to. So if you're in public in a group, let's say at a restaurant, and everybody is masked up, your risk of exposure goes way down. If, let's say, you're fully vaccinated and you don't wear a mask, but everybody else is masked, you still have a low chance of getting infection. Now, if everybody decides not to wear a mask, and not everybody is vaccinated, as we already know, then you have a chance of infecting other people. And again, it's not your choice. And what bothers me is this guy that's talking at the school board meeting claims to be a doctor, and he just does not understand, or he just refuses to understand how masks play a part in the overall way of mitigating the pandemic, because it also includes washing your hand frequently and social distancing. We kept that we flattened the curve. Remember that from last year? We flattened the curve because we had the lockdown, people wearing masks, washing hands, social distancing. And now you see these explosion in cases in states like Texas and Florida that don't allow mask mandates anymore. That's why you see these school boards and some of these school boards around Ohio bringing the masks back, especially for children that can't get the vaccine.
Hello, this is Doug, host of Secular Left, reminding you that I like to be validated. If you like this podcast and want to thank me, feel free to buy me a coffee. Go to buymeacoffee.com/secularleft and donate some cash to help make this a better show and validate me as a person. You'll feel better in the morning.
So I wanted to play this other clip for you. This other clip, it's another parent. I'm assuming he's another parent. Again, the audio kind of gets slow. It's slow to get started. But basically what he says is he went to Lowe's and bought a package of masks for his kids for school. And he happened to read the disclaimers or the disclosures on the packaging. And you could tell, and I could just tell you right now, we're going to listen to the clip, but I'll comment afterwards. He doesn't understand, liability law. And so let's take a listen to that clip.
Let's talk about masks. I'm not a doctor, nor do I play one on TV. For the record. I'm also not a lawyer, but I understand a little bit of common sense when it comes to liabilities. I wasted $13 on this pack of masks today at Lowe's. It clearly states right on the back, we make no representation about and are not responsible for or liable for the performance of this product. Right above that it says, this mask does not remove all risks of contracting any disease or infection. So, we've heard in the news we can't hold drug manufacturers liable for their vaccine, which is this miracle drug. So who do we hold liable when these masks are causing problems with our children years down the road? Is it the school board that mandated it? Is it the teachers and the principals who enforced it? Is it our lovely elected officials in Columbus or Washington? Who's going to be held responsible for making this, for making us put our kids in it? I know this isn't a question and answer session, but please start to consider this for decisions that get made. Thank you.
Okay, so I can tell you right now that any product that you use in your body that can affect your health, you're going to see disclosures exactly like that. That we are not responsible for anything that happens to you if you use this product. That's just standard liability language. And they do that because people have sued manufacturers because they used the product wrong and got harmed by it for some reason. And so they sue the manufacturer because the manufacturer didn't say that that was a possibility. And then they try to claim negligence. So now any packaging for anything that involves that you could get sick from or could hurt you in some way if you used it wrong, they put that standard packaging on there. But to answer that guy's question, he's like, what if our kids get sick or something happens to their kids from these masks? Who's liable? Well, first of all, it's not going to happen, especially unless you buy it off of a back of a truck like Fred's truck and you don't know the source. It's not going to happen. You know, they're only as nothing has changed about the masks that have been around for years and years and years. They're in packaging. They've been constructed in as a situation where they're not like hospital sterile, but they're in general. You know, and if they weren't safe for people to use, they wouldn't be on the market. You know, and that's another argument that these anti-mask people use to undermine health officials as they try to claim that using masks can harm you, which is the total opposite. That's not the case. Nobody has offered any evidence that a mask can harm you. But I can think of one way. I'm sorry. I can think of one way. If you wad it up into a ball and try to eat it, it could possibly get stuck in your windpipe and you could choke to death. That's one way it could harm you. But simply wearing a cloth mask is not going to harm you unless you wear it and your activities are, if you wear a cloth mask and go into, I just read an article today, some people died in a manure pit. So yeah, you could get harmed wearing a mask if you went into a manure pit, but it wasn't the mask that harmed you. It was the fact that you went into a manure pit without any air. But that's what these people do. They have no clue. They don't know how science works. They don't know how the law works. They don't know how logic works. And they undermine medical science. Of course, they undermine medical science, then they get sick and end up in the hospital, and then they want the doctors to do everything they can to save their lives. Well, here's a simple way of saving your life. Wear a damn mask. Get the vaccine. Stay at home. There's your choice. But like I said, it's just ticking me off. And then come to find out this week that the anti-vaxxers encouraged their buddy, Representative Scott Lips here in Ohio, to reconvene the health committee. And they're still, the Ohio legislature technically is still on their Labor Day break. They're on vacation until after Labor Day. But he got permission to bring his health committee that he chairs back on August the 24th to hear testimony on House Bill 248, which would prohibit anyone, anywhere in the state of Ohio from mandating vaccines, masks, and discriminating against people who refuse to get vaccinated. That's like pouring gasoline on a campfire. It's just going to go out of control. We're going to end up like Texas and Florida, where their hospitals are overwhelmed. And Florida, they just asked for emergency ventilators out of the national stockpile because they ignore the science. And they like to do that. They like to ignore the science. They like to talk big about government mandates, that businesses are far too regulated. And the thing is, when we're talking about public health, we need regulations. If we didn't have public health regulations, it would be a crapshoot whether or not you got safe food most of the time. Nowadays it's on occasion you might get food poisoning. But before there was the FDA Act that created the FDA, it was more common for people to get food poisoning from restaurants and stuff that they bought at the store, because there was no regulation. Because businesses do not self-regulate unless it costs them money to do so. To not do so, I mean. That's the only time they regulate, is if it costs them money if they don't regulate. They don't self-regulate to be benevolent. So you have people like Representative Lips, and there's probably a dozen more, I can't think of their names offhand, on this health committee. This is the same committee that made a mockery of Ohio by having some doctor who claimed that the vaccine made her magnetized. And they're trying to pass this bill. And people will say, well, Doug, the governor doesn't like it, and he said that he doesn't like those kind of things, so veto it. But he's not buddies with the legislature right now because of all the previous health orders that he made. In fact, they passed a law that prohibits him from making any long-term health orders anymore. And if he does, the legislature has a right to undo it with a simple vote. That's how much public health is worth to the Republican Party in Ohio. A simple vote. They don't care. They put in these regulations of trying to prevent women from getting abortions to protect the children. And then when they have a chance to really protect children, they don't want to do it. because they want to pander to their base, the illiterate science deniers that think that they know more because they saw a video on YouTube. And there was a Facebook group where that posted those videos, and I was I was commenting about that. And that's what some of these people did, is they showed me this video of a doctor in Indiana, and according to the video, shredding the school board about a mask mandate. And they're like, see, here's proof. Here's a doctor who doesn't think masks work. But the thing is, if you looked closer at the person, at the doctor, he was a family medicine doctor. He was nothing like Dr. Fauci, who actually has a degree in viruses and stuff like that, and pandemics. This is a family medicine doctor. This is somebody that you go to when your child has a whooping cough or a skinned knee or something like that. You know, he's a doctor. He went 8 years of school. I found a paper that he'd written about, that he participated in, about some kind of cardiology thing. He has no experience in biological issues like viruses. So him being against masks is his personal opinion, because it does not match the worldwide consensus on using masks. It isn't just the CDC, it's worldwide. The World Health Organization and all the health authorities in Britain and France and Germany and Norway and Sweden and Russia and everywhere, they said mask. This is what you need to do with masks. You know, in France, they have a rule, and it just happened in Italy too recently, that you have to show proof of vaccination in order to go into a restaurant. Because they are the ones that want to try to end this pandemic. And this circus thing that we got going, making masks political, like we're saving the children, is undermining efforts to end the pandemic. It's making the pandemic longer. And it's putting more people in danger, costing this country far more money in health costs than it should. You know, I bought a box of masks at the beginning of the pandemic. It had 50 masks in a box. I bought 2 boxes. We've gone through 1 box. I have some cloth masks now. But those masks are far more cheaper than the $30,000 to $40,000 that you're going to spend in the ICU or the being on a ventilator, because you're too inconvenienced to wear a mask, because you deny the science. And I don't feel sorry for you if that happens to you, because you're an idiot. And I'm sick of you. I'm sick of what you're doing to this country. And what you need to do is you need to get your head out of your ass, listen to the medical experts and the science, and do what you're told, so we can end this pandemic. I don't like wearing masks either. I want to be able to go to a restaurant and not have to worry about that I'm going to get sick. I'm fully vaccinated, so I may not get very sick. I don't know. This is all new. But I'm not going to sit here and tell you that I know more than Dr. Fauci. And I think it's arrogant of anybody to think that they do know more. And it's got to stop. It's just got to stop. And the people who are tired of it, other people like me who are tired of it, we need to rise up and we need to stop this cold. And we need to do it now. And we need to do it today. Thank you. Thank you for listening to this episode. You can check out more information, including links to sources used, in our show notes on our website,
at secularleft.us. Secular Left is hosted, written, and produced by Doug Berger, and he is solely responsible for the content. Send us your comments either using the contact form on the website or by sending us a note at comments@secularleft.us. Our theme music is Dank and Nasty, composed using Amplify Studio. See you next time.